BEONTV UK, for the community, by the community. www.beontvuk.com.
Lal Haweli Restaurant at the heart of Walsall. BBC Welsh Curry Award-winning chef Abul Hussain presents most unique and amazing tawa dishes with many flavours and choices. Eat with your family and friends. A unique dining experience never to be missed. Lal Haweli, a 400-seat capacity restaurant perfect for any small parties and functions. Special seating arrangements for ladies and families with prayer facility inside. Mouth-watering tawa dishes. Join Tawa Festival at Lal Haweli. Lal Haweli, home of Tawa, 1 Midland Road, Walsall.
আপনি কি আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট, ওভেন এবং ক্যানোপির বিশ্বস্ত প্রতিষ্ঠান খুঁজছেন? তাহলে আর ভাবনা নেই। সুদীর্ঘ 20 বৎসর স্পেন এবং ইতালিতে সুনামের সাথে ব্যবসা করার পর এখন বার্মিংহামে খোলা হলো আমাদের ফ্যাক্টরি। আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট এবং ক্যানোপি আমরা গ্যারান্টি সহকারে তৈরি করে থাকি। Birmingham Commercial Cooker Limited. Phone 07952978136.
BEONTV UK, for the community, by the community. www.beontvuk.com.
আজকে একটা ডিফারেন্ট টপিকস লইয়া আজকে প্রোগ্রামটা হইব। আজকে প্রোগ্রাম আমার একজন স্পেশাল গেস্ট। হি ইজ এ পেডিয়াট্রিস্ট। পেডিয়াট্রিস্ট বেসিকলি লেইম্যান ল্যাঙ্গুয়েজ লেখে ফুড ডক্টর। বিভিন্ন দেশও তারা ডক্টর টাইটেলে ইউজ করে থাকে। ইন দ্য ইউনাইটেড কিংডম উই আর এ ফুড স্পেশালিস্ট। আর টপিকটা হইব গিয়ারি আর্থারাইটিস অ্যান্ড ফুড পেইন আর কন্ডিশন অ্যান্ড ট্রিটমেন্ট। এই ধরনের সমস্যা যদি দেখা যায় কিতা করা, কী ধরনের ট্রিটমেন্ট করা আর কোন ট্রিটমেন্ট উড ওয়ার্ক, ই মোস্টলি হচ্ছে গিয়ারি যে ফুটের যে প্রবলেম থাকে উইথ আর্থারাইটিস অ্যান্ড রুমেটয়েড আর্থারাইটিস, এটা কিছু কমপ্লেক্স। সো কমপ্লেক্সিটি ইনশাল্লাহ আমার যে কলিগটা হি উইল এক্সপ্লেইন বেটার দেন মি in that subject because he is expert in that subject. And again, আমরা এটা লাইভ শো, লাইভে অনেক জিনিস হইতে পারে, তো আমরা যদি ভুল ত্রুটি করিয়া থাকি please forgive us. Now let me introduce myself to my colleague. He's also my friend, right? And he's a podiatrist. Assalamu alaikum.
Alaikum.
How are you, Tausif?
Alhamdulillah.
How are you keeping yourself?
Not too bad at all.
Right.
Yeah.
If you would introduce yourself to our audience.
Thank you for having us on the show. My name is Mohammed Tausif and I am a rheumatology specialist podiatrist. I graduated SOMUZ in 2010 from Huddersfield University. After graduating, I went to start working for the National Health. After National Health, I started working locally in Birmingham, Sandwell and West Birmingham Hospital Trust as a rheumatology specialist podiatrist. Following that, I took on a job in Buckinghamshire Trust as a rheumatology clinical lead. So a lot of experience with regards to arthritis, especially the inflammatory arthritis. A couple of years back, I finished my master's in clinical biomechanics from Stafford University, and now we have a private clinic on Harborne High Street where I'm working full-time privately, providing solutions for the foot pain.
And in Urdu terminology, just briefly.
Urdu terminology.
Yeah.
मेरा नाम मोहम्मद तौसीफ है और मैं पाँव के आर्थराइटिस का स्पेशलिस्ट हूँ। मैंने पिछले 10 साल एज अ पाँव के स्पेशलिस्ट पेडियाट्रिस्ट NHS में काम किया है। मेरा फोकस जो है वो इन्फ्लेमेटरी आर्थराइटिस जो है पाँव की सूजन की वजह से जो आर्थराइटिस हो जाता है उसमें मेरी स्पेशलिज्म है।
Thank you. So basically, Urdu te hoili se Urdu Bengali te samanoi. So hopefully shaklo ita understand also. Now, slide 2 please. Asker kolam nani asker je topic toy bogari. Hokta condition loya topic toibo. Mainly would be Oyster Arthritis, ita costa kita, Rheumatoid Arthritis, another name is RA, Tendonitis, motor neuroma, bursitis, gout, oh very common gout, I mean is shiktam sai moze gout kizinishta, and boniano kizinishta ito mani ekta janar moto amdar very important to understand the bonian. So basically osteoarthritis, rheumatoid arthritis, tendonitis, motor neuroma, bursitis, gout, and bunion. So hopefully my colleague will start off with osteoarthritis. If you could.
Thank you.
Elaborate on that, please.
I wanted to add osteoarthritis in this presentation because that's the most common form of arthritis that we suffer. It's very common in our Asian community. Predominantly, most of the body gets affected by it, but we are going to focus on the foot and ankle. It's usually called wear and tear arthritis, so with age, certain medical conditions do come about, and the joints get worn out with movement, with all the forces that you put through the joint, and they become stiff and painful. In feet, ankle joint, big toe joint, little toe joints as well are very common areas which get affected, and they become painful.
So how do we investigation? How do we do simple investigation, like X-rays and all this?
Yeah, so simple investigations are if you are experiencing any symptoms as painful joints, or you're getting stiffness first thing in the morning, you can go and approach your GP, or you can go and see a podiatrist, where we can assess the joint, we can order X-rays, we can do an ultrasound examination, and we can figure out what's actually happening in the joint and diagnose. Osteoarthritis is relatively easy to diagnose.
Yeah. One thing you mentioned about ultrasound, both of us got ultrasound.
Yes, that's right.
And aren't we looking for, well, I am looking for X-ray actually, I'm talking on that.
Yes, I know you. And
you've seen that when we went to that supplier.
Yes, yeah. I'm very excited about it, so I'll be sending you my patients.
Yeah, we're looking into it. It's still a bit hiccups on that area, but inshallah you'll be there, because if you're determined, and it's another good tool to have.
Absolutely.
Right.
Absolutely.
So again, we're still on osteoarthritis, the treatments.
So again, the treatment depends on how severe the arthritis is. So early on, gentle sort of exercises, along with occasional analgesics like tablets, paracetamols, ibuprofens, they usually help with the treatment. If it becomes really severe, then in the clinical environment, we do inject the joints with steroid, and there are other injections available, such as HA, Osnil, which
I love the Trumil.
Trumil, absolutely, absolutely.
Which is the alternative to steroids.
Yes.
And there's another kid currently on the block around you and me trying to discover. It's called the Class 4 laser, isn't it?
Exactly. Class 4 laser has...
Elaborate a bit on that for me?
Yep. So Class 4 laser has been absolutely amazing with regards to treating the effusion, swelling and pain in osteoarthritis. I have been having really good results. 6 weekly sessions of Class 4 laser has reduced the pain, stiffness, inflammation in the joints, and we have been able to give exercises. Patients have been able to do the exercises together with that and have reasonable outcome.
Thank you, Tausif. That was really good. Again, if you would just finish it off in Urdu.
In Urdu, जोड़ों का दर्द जो है वो बहुत कॉमन है यूके में, पाकिस्तान में, around the world, absolutely. और हमारी एशियन कम्युनिटी को मोस्टली जोड़ों का दर्द जो है वो होता है, जिसमें जोड़ जो है वो स्टिफ हो जाता है और उसमें दर्द होना शुरू हो जाता है. आप जब सुबह उठते हैं और चलते हैं, उससे आपको स्टिफनेस और जोड़ों का दर्द होता है, जो स्लोली ईज ऑफ हो जाता है एज द डे गोज ऑन. उसके लिए ये relatively easy है इसको diagnose करना. अगर आप अपने GP को देखते हैं, GPs X-ray कर सकते हैं. हम लोग भी X-ray request कर सकते हैं. As a podiatrist, we have ultrasound which can be used, जिसको use करके हम diagnose कर सकते हैं. Treatment के लिहाज से mostly जो है वो gentle exercises बहुत ज़रूरी हैं. Exercise जो है वो arthritis के लिए बहुत ज़रूरी है. उसके अलावा analgesics हो गई, injections जो हैं, अगर आपका arthritis जो है वो बहुत ज़्यादा severe हो गया है तो injections such as steroid हो गए, hyaluronic acid हो गया, class 4 laser जो है वो बहुत अच्छी है joint arthritis के लिए. So
thank you my friend. Basically aki je oyster arthritis ta amra explain kortam sairam aki eta basically dryness ar eta amar colleague hoira tain eta quite easy to diagnosis is eta quite easy to recognize aki ar eta je treatment ta eta many type of treatment ase mane tablet o ase amra podiatry field o amra insolo ব্যবহার করি বা কারেন্টলি ইনজেকশনও দেওয়া যায় লাইক স্টেরয়েড ইনজেকশন ডাক্তার হল দিতে পারে তো অ্যাজ এ পেডিয়াট্রিস্ট আমরা দিতে পারি আর বর্তমানে কি আমরা দুইও কলিগে কি দেখি আর ক্লাস 4 লেজার ইটস কোয়াইট দ্য রিজাল্ট উই আর গেটিং বেটার অ্যাজ ওয়েল সো ইউ নো হিট অ্যান্ড মিস বা খারাপ নয় রিজাল্টটা খুবই ভালো ক্লাস 4 লেজার ইটস সেফ অ্যান্ড এফেক্টিভ এনিওয়ে থ্যাংক ইউ আমরা যাই মনে স্লাইড 4 আর ইটোইব গ্যারি আর একটা very hot topic আর very good condition. I wouldn't say good obviously if you got it, but a condition to know of it and understand of it. It's called rheumatoid arthritis. So I'm going to go back to my colleague again. Now that's something, if you could explain me, I need to learn about rheumatoid arthritis.
I'll try my best.
Okay.
So rheumatoid arthritis is an autoimmune disease which affects the joints, predominantly hands and feet, where joints swell up and they get inflamed. It affects other parts of the body, but predominantly it's hands and feet, and then the other joints. It's a very common condition which is caused by, we don't know what it's caused by, and there's a very strong hereditary sort of connection with rheumatoid arthritis. It's a very disabling condition.
Basically, people who's got rheumatoid arthritis, quite good signs on the hand, isn't it?
Yes.
So on the hand they can see that bones
The deformity.
So that's quite. There's a two type of arthritis, or there could be another type, but with generally two type. One rheumatoid arthritis, and one is oyster arthritis. Duota kintu different. They're different sign and symptom, right? Rheumatoid joint e ekটু inflamed থাকে আর কিছু bend থাকে আর কি anyway.
So it's important if you feel that you have any signs or symptoms of an arthritis which is inflammatory in nature, it's important to seek help as soon as possible. According to NICE guidelines, you have to be on the medication for rheumatoid arthritis within first 3 months. Otherwise, the risk of you getting deformities is much higher.
Okay, and how do we investigate?
So investigation, this is much more complex as compared to osteoarthritis. Investigation with regards to rheumatoid arthritis goes in a very periodic sort of fashion where you have to see your GP. GP has to get like blood test done, and there's certain markers has to be checked in. If these markers come up, they refer you on to a specialist rheumatologist who will do further examination, not only with regards to the bloods, he'll do further physical examination as well. Following that, he will decide whether you have rheumatoid arthritis.
Again, we can use ultrasound, X-ray, many other tools.
Yeah, to assist with the diagnosis. Yeah.
Okay, what about the medication-wise? How do we will?
So this is the very complex issue with regards to the medication, and I really want to touch upon this. Is that working in Sandwell and West Birmingham Hospital, my dealing was with predominantly Asian patients. who are suffering with rheumatoid arthritis.
I was just about to ask you that.
Yeah, so our common belief is that we want to stay away from the medication. We want to use the traditional medication to control that disease, and we're very fixated and focused on that, and we want to consider medication as a last resort. Because, of course, everybody is worried and scared about the fact that medication can cause side effects. So if there is one condition where I would advise you not to do that, that's rheumatoid arthritis.
Okay, so
a delay, just to quickly add on to this, a delay in medication means that the joints are inflamed for a longer period of time, and once they've been inflamed for a longer period of time, the deformity set in.
It can build up, isn't it?
You can build up, and it's non-reversible.
Yes.
Unfortunately, it's non-reversible.
That's why, like you said from the beginning, that rheumatoid arthritis, the complex one we call
yes.
it. Even as a clinician, we get baffled with it.
Absolutely.
And even within our own rheumatoid, sometimes I have to even, it doesn't matter how expert you are, sometimes second opinion or third opinion is far better than jumping into a quick conclusion. It could be many things happening in there. Joint is a complex itself.
Absolutely.
So, Tausif, if you could say in Urdu again.
Urdu.
Quick one.
पाँव की joints की सोजन जो autoimmune disease की वजह से होती है, वो बहुत ही serious बीमारी है, जिसमें हाथ, पाँव और other joints भी affect हो सकते हैं, लेकिन predominantly हाथ और पाँव affect होते हैं. अगर आपको इस बीमारी, अगर आपको होता है कि आपके जोड़ जो है वो दर्द होने लगे हैं और वो सूज गए हैं, आप फ़ौरन तौर पर जीपी से रब्ता करें, और जीपी जो है वो ब्लड टेस्ट लेगा. आफ्टर ब्लड टेस्ट दे विल बी एबल टू चेक कि आपके जो इन्फ्लेमेटरी मार्कर्स हैं वो कैसे हैं. वो फर्दर आपको रेफ़र करेगा रूमेटोलॉजी स्पेशलिस्ट को, जो उसको फर्दर इन्वेस्टिगेट करके डायग्नोज करेगा कि आपको ये बीमारी है या नहीं. इसकी वजह ये है कि आपको बहुत जल्दी उसको कांटेक्ट करना पड़ेगा, बिकॉज़ जितनी देर आप इसको रहने देते हैं उतना ही डैमेज जो है वो ज़्यादा हो जाता है. ये नॉन रिवर्सिबल कंडीशन है जिसका कोई क्योर नहीं है, और अगर आप इसको फिल वक्त जो है इसका इलाज नहीं करवाते तो जोड़ जो है वो डिसेबल हो जाते हैं, और जो डिसेबिलिटी है वो लॉन्ग लास्टिंग होती है.
Thank you. Basically, আমার কলিগে কইতাছে যে rheumatoid arthritis-টা এটা যদি হয় তে এটার জিপির কাছে যাওয়া ভেরি ইম্পর্টেন্ট. এটা জিপে ব্লাড টেস্ট করতে পারে বিভিন্ন, আর এই কন্ডিশনটা যদি বাদ হয়ে যায় না, এটা রিভার্স করা যায় না, এটা আরও ড্যামেজ করে আর কি. আর এটার বিভিন্ন টাইপ অফ ট্রিটমেন্ট আছে, অথবা এটার যারা স্পেশালিস্ট রুমেটোলজিস্ট, ইটস অ্যানাদার ব্রাঞ্চ of specialism within the medical profession. So এটার কোনো neglect করতে হয় না. The quicker and getting the good advice or good treatment, your GP, or even if you go to the podiatrist, they'll probably have access to different type of department, or even send you back to your GP. অতটুকু আমার কলিগে কইতাছে যে এটা একটু কমপ্লেক্স আছে rheumatoid arthritis. আমরা যে পিকচারটা দিছি, পিকচার দেখলে দেখতে পারবা যে এটা কিছু পেইনফুল আছে, more than it can be more painful than osteoarthritis, isn't it?
Definitely. So the pain is something which is the main feature in this, which stays with you pretty much all the time.
Okay, brilliant. Slide 5. Right, that's my cup of tea. Tendonitis, or is it tenosynovitis? Which was it?
Right.
It's the same.
So the autoimmune diseases, they don't just affect the joints.
Okay, so they can tendon.
So they affect other structures in the body as well. And the other major structures which get affected by autoimmune disease, inflammatory disease, is tendons. In feet, it's very common. One of the biggest conditions I saw in my clinical practice when somebody suffered with rheumatoid arthritis is posterior tibial tendon dysfunction. PTDS. It's posterior tibial tendon dysfunction.
Yes.
So I wanted to touch upon this.
Yes, because as I said, it's quite exciting for me as well.
Yeah, and the reason I wanted to touch upon this is that there is a word called AAFDD, acquired adult flat foot deformity.
Yes.
Yeah, so that's very common, and that's common because of inflammatory arthritis, the tendon slowly degenerates,
Yes.
and it gets inflamed, and with the inflammation, it loses its function. And the tendon, posterior tibial tendon, the function of posterior tibial tendon is to maintain your arch area. And as soon as that goes, your foot slowly starts to basically collapse and collapse and collapse, and eventually becomes a flat foot deformity. Initially, it can be slightly flexible, but eventually it becomes a fixed deformity where there is no going backwards. So मैं अपने व्यूअर्स को ये कहना चाहूँगा कि अगर आपको इन्फ्लेमेटरी आर्थराइटिस है, आप यंग हैं और आपके इन्फ्लेमेटरी आर्थराइटिस से डायग्नोज हुए हैं, तो प्लीज़ go and see a podiatrist.
Absolutely.
Let them, sorry.
Yeah, go on. You could finish it.
Let them assess your feet. If they find that you have functional tendencies where your foot basically flattens out, you are a candidate where you will end up developing posterior tibial tendon deformity. So I was doing some work when I was in Buckinghamshire Trust, where we were getting all our newly diagnosed patients to come in and have an assessment, even if they haven't got any condition or foot problems, so that we can educate them about the conditions that they can have. And what I started to do is that we started to introduce orthotics and good footwear for all the patients where we felt that that could be a predisposing factor in developing a serious foot problem.
As we say, prevention is better than
absolutely cure. Yeah.
Yes, thank you. And investigation-wise, how do you, sometimes you can visually see it,
so,
isn't it?
Yes, there is. Somebody asked me a question, SOMUZ, that what is the difference between a podiatrist, a musculoskeletal podiatrist, and a rheumatology specialist podiatrist?
There are differences.
And the difference I explained to them is that when you're dealing with patients who have inflammatory arthritis, autoimmune disease, the understanding about the medical conditions, the understanding about the medication that they're actually taking is a very key factor in treating them patients. To give you an example, a patient comes in with pain in their arch area. You see the patient and you assess that this is posterior tibial tendon deformity. Following that, as a rheumatology specialist podiatrist, I would have a look at their bloods, I would have a look at their rheumatology factor, I would have a look at their medication, I would have a look at their disease activity control, and once I've assessed all these things, following that I create my treatment plan. And the way it can change is that if I find that they have their disease activity control is really high, then I know simple podiatric interventions of footwear, orthotics, gentle other treatments isn't going to be enough. They need to see their rheumatologist who can tweak their medication, and once they've tweaked their medication, combination of all these things is what resolves the problem. And
there again also a teamwork as well.
Absolutely.
The MSK has their own role, specialist has their own role, general podiatrist is their role. It's a teamwork. Basically, our colleague hoyto sairo je rheumatoid ba any arthritis e aro body ongo yo effect korte pare, such as tendon effect হলে মানুষের যে ফাউটা ডিজেনারেটিভ হয়ে যায়, মানে আস্তে আস্তে ক্ষয়ে যায় গিয়ে, তখন ফাউ ফ্ল্যাট হয়ে যেতে পারে। এটারও বিভিন্ন ধরনের করে যে পডিয়াট্রিস্টের মাঝে কি আমরা ফুট ডক্টরের মাঝে আমরা বিভিন্ন স্পেশালিটি আছে, সো উই ওয়ার্ক টুগেদার। Thank you. That's nice to know about, learn something about tendonitis. Right, we go to slide 6, bursitis.
So, again, coming back to the inflammatory arthritis, so one of the things that actually affect is bursitis, and bursas are a fluid-filled sac which are present on most bony prominences, and in foot and ankle, the ones which get affected with rheumatoid arthritis is intermetatarsal bursitis. So you have in between the joints, they get inflamed. Following the inflammation, it feels like that you're walking on pebbles. Your ball of your joint becomes really uncomfortable when you put shoes on, because your foot has actually become a bit more wider. It becomes really painful to put shoes on, and that's what bursa is. That's what bursitis is.
Basically, sac of
fluid which gets inflamed. Or
maybe sac, some sort of sac.
Yeah.
And the investigation-wise, how?
So again, ultrasound is one of the best ways.
Because I can see most of the time you're mentioning ultrasound. So there you go. Ultrasound does have a place in podiatry practice. For those podiatrists who are watching us throughout the world, I'm afraid both of us in here a bit advocate of, maybe bias, but it's a tool or gadget to have in the practice.
Absolutely. It's ultrasound played a big, massive role in my private practice, as well as when I was working in the National Health, in terms of diagnosing and treating the rheumatology conditions. And bursitis is an amazing, it's amazing to view the bursitis under an ultrasound, and that can actually help us guide to do the injection, because it's the inflammation.
I was just about to come to the treatment.
Yeah. So in terms of the treatment, a lot of the time the treatment for the bursitis, if it's affected with the rheumatoid arthritis, then you have to look at the medication. You have to review their disease activity control. Once you've reviewed that, pain persists, then a gentle dose of steroid injection is a fantastic treatment for bursitis.
Absolutely.
And if you do it under ultrasound guided,
that's just far better, isn't it?
Yeah. Absolutely.
Basically, bursitis is a jointer maze ফ্লুইড লাগানি বান্দিলা একে কিন্তু ইটাই অনেক ধরনের পেইন করতে পারে, স্পেশালি যদি আটারুটি করো। ইটার যে ইনভেস্টিগেশন অথবা আমরা টেস্ট হয় আর কি, এটা আল্ট্রাসাউন্ড হইতে পারে, এমআরআই হইতে পারে, ও ফিজিক্যাল টাচ বাই সামটাইম উই টাচ ফিজিক্যালি pain যখলে you can feel it, it's some sort of bursitis there. Treatment, again, many complex. Putting our podiatrist hat on, we have one type of treatment, but we could also work with other specialists within the field. But mainly orthotics can be there, injection, lifestyle, or modification of footwear, or it could be latest gadget if you have, or any sort of even I would say complementary therapy sometimes helps. But again, that's another different topics. Thank you. That's a good topic again, bursitis, something I was looking forward for it. So slide 7, please. Okay, another good topic would be motor neuroma. First of all, before I do motor neuroma, can you explain me what is that Mr. Motor Neuroma? How does this name came about?
You can enlighten me on that. So how did this name came about?
It's a guy who invented, like anything else in the world. Whenever one day you may invent, and you could Tausif something. So there you go. It was Mr. Morton or something. But anyway, I wanted to know what is motor neuroma and what the cause of it, and the investigation of it, and the treatment of it, please.
Okay. So with regards to motor neuroma, these are the conditions which anybody can have, regardless of the fact that they have rheumatoid arthritis or not. The reason I've added these conditions because they are specific to the arthritis. It relates to that. It's something which comes through my door on a very regular basis when I was a rheumatology specialist podiatrist. So hence why I've included these key things so people can actually have a look at them and say that what needs help regards, and there are very simple treatments for these. Motor neuroma is an entrapment of the nerve between predominantly third and fourth, but it can be in between second and third. I've seen in fourth and fifth as well, very slightly, but it's like third and fourth is the key one. When I see motor neuroma, and predominantly the reason for that is because as joint deformities set in, the toes become deformed and you end up developing bunions. That pushes, with the footwear as well, that pushes and compresses the nerve. And that's what motor neuroma is.
And again, investigation, ultrasound, physical touch.
So yes, it's
because when you squeeze it like
exactly.
that.
So whenever you have musculoskeletal conditions, your hand is the biggest tool.
Oh yes, we are podiatrists.
Yes, it's the biggest tool.
Yeah.
So by if you know your anatomy, and by just pressing and identifying the structures which are affected by, which are causing the pain, is your biggest diagnosing tool.
Yes.
Following that, of course, ultrasound is very sensitive, very good at picking neuromas. You can see the changes that are going on,
yeah.
absolutely.
Or if you squeeze it, if it's
yeah.
very visible, you can see that shape around it.
Exactly. So that's a very, motor neuroma is relatively easy to diagnose.
Yeah. And treatment-wise?
Treatment-wise, again, we are going to look at predominantly from the inflammatory arthritis point of view. So the things which I consider when I'm looking at that is that footwear is one of my biggest challenge and advice, because with deformed foot, you need a footwear which is big enough, deep enough, which is not always as easy to find, and they don't always look very good to wear. And as inflammatory arthritis, especially rheumatoid arthritis, is very common in ladies, so their footwear is particularly narrow and stylish. So footwear is one of the biggest advice that I give to the patients. Orthotics do a relatively decent job of assisting with the neuroma, and again, I keep mentioning the injection, but the injection do help.
Yes, and laser. Okay, so now slide 8 please. Now the final part, and I like this part as well. It's about gout now. That's a juicy bit, isn't it?
So gout is a very interesting one for me. It's something which I've seen many times in clinical environment, in acute stages as well as in a very chronic or aftermath of gout, when the joint has had so many gout attacks that it completely lost its ability to move. So gout is a buildup of uric acid in our joints, and it could be excruciatingly painful. When you have a gout attack, it's really hard not to be able to tell that it's gout, because the joint swells up, it becomes red, hot, painful, excruciatingly painful, shiny, and you can't do anything else. You can't go to sleep. You can't even. The common one that we hear from patients is that, oh, I can't even put a quilt on it.
No, because it's
that painful. Yeah. So that's gout.
And again, so when we investigate X-ray, looking at it itself, like you said, I say that consultation.
Exactly.
It's the best thing you can do as a healthcare practitioner. So a blood test as well. That's
absolutely important. Gout's a very common one, especially in our Asian community, because we love our red meat, don't we?
Food.
We love our rich food. So some of the causes for gout is our unhealthy lifestyle.
Okay.
Red meat is a very big factor. In it. Some of the medication, which we pretty much see most of our Asian patients be on, that is diuretics, blood pressure tablets.
Good.
So they both can actually cause gout.
Okay.
Yeah, and on top of that, some of our listeners who like to drink, so alcohol, red wine, can certainly contribute to developing gout.
Another question I want to ask, does gout has anything to do with the male and female?
Yes, more common in males, clearly.
Okay, so there are evidence there, the male. So if you could to summarize in short Urdu and then I think we're done for today.
Gout, I think Urdu में gout जो बीमारी है मुझे उर्दू में पता नहीं है कि इसको कहते क्या है.
Neither, so but just explain the symptoms and the treatment.
Gout जो है वो acute जो sudden attack है. मेरी उर्दू भी जो है वो अभी निकल नहीं रही.
Yeah, just explain.
Acute joint pain जिसमें जो जॉइंट है वो सूज जाता है, बहुत शाइनी, बहुत ज़्यादा दर्द होता है. अगर आपको इस तरह का कोई जॉइंट का दर्द होता है प्रिडोमिनेंटली आपके बिग टो, आपकी एंकल में भी हो सकता है, लेकिन बिग टो इज़ द बिगेस्ट कल्प्रिट. सो जो जोड़, अगर बिग जोड़ में आपकी उंगलियों में इस तरह का दर्द होता है तो आप फ़ौरन जो है वो अपने जीपी से रब्ता करें और या पोडियाट्रिस्ट से रब्ता करें, जिसकी और हम इसको डायग्नोज कर सकते हैं और उसको ट्रीट कर सकते हैं. ट्रीटमेंट जो है many types of the treatment. Just to actually quickly उर्दू में बता दूं आपको कि इसकी जो मेन वजूहात है वो ये हैं कि रेड मीट्स, जो इंसान रेड वाइन पीते हैं, आपका अनहेल्थी लाइफस्टाइल, अगर आप ब्लड प्रेशर की गोलियां खाते हैं या फिर आपको वाटर टैबलेट्स हैं, अगर आप वो लेते हैं तो आपको गाउट का अटैक हो सकता है. तो अगर आपको गाउट का अटैक होता है तो आप उसके लिए पोडियाट्रिस्ट से या जीपी से रब्ता करें.
Thank you, and it was really interesting. As I said, even as a podiatrist myself, I've learned every day is a learning day.
Absolutely.
So Tausif, thank you for coming to the show.
Well, thank you for having us.
It was nice to. Any last message to our audience?
I think my message would be is that this is a fantastic show, SOMUZ. Keep watching this show.
It's educational, isn't it?
It's educational, absolutely educational, and some of your presenter has been absolutely amazing.
Thank you.
And I've learned quite a bit, and I'm sure your listeners learned quite a bit as well.
Thank you very much. আর আজকে কইলাম না আজকে গাউটের সম্বন্ধে আমরা যে প্রোগ্রামটা সাজাই, more education and more awareness. আর যতক্ষণ আমরা অ্যাওয়ারনেস শিখাইতাম পারি বিভিন্ন টপিক লইয়া, বিভিন্ন স্পেশালিস্ট লইয়া কি. থ্যাংক ইউ আপনারা যারা থ্রু আউট দ্য ওয়ার্ল্ড আমরা যারা বিয়ন্ড টিভিত কেউ যদি আমার গেস্ট আইতে চান ওইতে চান প্লিজ বিয়ন্ড টিভির লগে যোগাযোগ করবাই. অ্যান্ড বিয়ন্ড টিভি ইজ এ কমিউনিটি চ্যানেল and we are growing faster. So keep watching Beyond TV. Assalamu alaikum and good evening to everybody.
কি আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট, ওভেন এবং ক্যানোপির বিশ্বস্ত প্রতিষ্ঠান খুঁজছেন? তাহলে আর ভাবনা নেই। সুদীর্ঘ 20 বৎসর স্পেন এবং ইতালিতে সুনামের সাথে ব্যবসা করার পর এখন বার্মিংহামে খোলা হলো আমাদের ফ্যাক্টরি। আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট এবং ক্যানোপি আমরা গ্যারান্টি সহকারে তৈরি করে থাকি। Birmingham Commercial Cooker Limited. Phone 07952978136.
BEONTVK UK, for the community, by the community. www.beontvuk.com